Hi. Hello, everybody. Welcome to Knock Knock Hi with the Glaucomfleckens. I am your host, Will Flannery, also known as Dr. Glaucomflecken.
And I am your host, Kristen Flannery, also known as Lady Glaucomflecken.
Do you have allergies?
I don't know if it counts as an allergy. I mean, I feel like mosquitoes, right? Everybody's allergic to mosquitoes. That's why mosquito bites itch. But mine get ridiculously large and red. So I don't know if that's an allergy or what.
I have an allergy to puns.
Yeah.
I have
Do
an
you break out
allergy
in hives?
a little bit. Yeah.
Mhm.
I have an allergy. To. Actually, no, I don't have any allergies. No, because I'm perfect in every way.
Oh my God. I was going to ask a serious question, but why do I bother?
I don't have any allergies. I feel for people who do because they seem pretty terrible. But we're talking all about allergies today.
Yes.
Because it's a part of healthcare that I know very little about. And
yes, and it is part of immunology, which you probably knew, but I did not. I learned that today.
Yep. The immune system is a fickle beast.
Yeah, really is. Kind of a blessing and a curse.
So, we're going in depth about cytokines. No, we're not. I'm just kidding. We're not doing that. It would not make for an exciting podcast.
Well, it would to some people. There'd be about 10 people that would really be interested in that.
Yeah. I mean, I guess we could do it, but
no, you can't.
That would be a very short podcast because I don't know anything.
Exactly.
Interleukins.
Okay.
That's a thing.
All right. I've heard that word.
MHC complex.
All right. People are tuning out already.
Complement pathway.
That one sounds friendly.
Yeah. There's direct and indirect. Or is it no? Is it?
Oh, boy. Okay. Well,
primary,
today
secondary?
we have Dr. Zachary Rubin.
Yes. You guys probably know him or maybe have seen his content on TikTok. He came up big. He's got over 1 million followers. He's verified on TikTok.
That's right.
He's the hula hooping, bow tie wearing allergist immunologist.
Yes. Hard to mistake him for anyone else.
Yep. He's in private practice. He sees mostly kids, but as he talks about the scope of what he can do as an allergist immunologist, very common for them to see adults and kids, but he sees mostly kids.
Or kids that turn into adults.
Yes.
The lifespan.
Which is very common. And so he's practicing out there in Illinois, and I had a wonderful conversation with him. It's great.
Yes,
he's his content
a nice
so
guy,
much.
very smart.
Nice to finally, talk.
Yeah, it is.
After interacting on social media so often. So,
and he makes it's a very complicated topic, but he makes it all very simple, easy to understand.
Yeah. He's got a gift for the medical education for a general audience, which is I found it's a very valuable skill that I'm still trying to get better at and trying to do with all the knock knock eye stuff.
Yeah.
But so I appreciate anybody who can do that and just, take a complicated topic and really make it accessible, you know? So let's get to it, shall we?
Yeah.
Here we go. Here's Dr. Zachary Rubin. Today's episode is brought to you by the Nuance Dragon Ambient Experience, or DAX for short. Look at this little DAX here.
Little buddies.
To learn about how DAX Copilot can help reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit nuance.com/discover-DAX. That's nuance.com/discover-DAX. All right, we are here with Dr. Zachary Rubin. Zach, thanks so much for joining us.
Thank you so much for having me. I'm really excited to be able to talk to you finally. I don't know if there's ever been an allergist next to an ophthalmologist before. It's kind of eye-catching, really. I mean,
okay, it is. Eye allergies do exist.
Yes,
but
that is true.
But we don't do like patching, like the extensive testing that you are.
You don't drop like irritants into the eyeballs to see how they react.
We don't.
There was a time though when they would do direct challenges back in the 50s.
Oh,
that was a thing, very archaic, but we don't do that anymore.
Yeah. Well, I want to get into all the allergy stuff here because obviously, like, I don't have an allergist character in my repertoire of characters, hospital characters, and trust me, Zach, I've heard about it from a lot of people. Like, in fact, maybe you were the one that
It was me at one point when I was still on Twitter. I would definitely troll you a little bit, being like, "Where's that allergist gonna come?
Yeah.
When are
Hey,
they
it's
gonna come?"
fair. It's fair. So
Have you ever even interacted with an allergist, like, in your training?
no,
I didn't think
no.
so.
Yeah, in fact,
He's
Zach,
got nothing to draw
I
on
I
here.
think you might be the first allergist I have actually like spoken to, and maybe
That
even
might be
seen.
true. Yeah, yeah,
Do
and
they
you
all
might be.
look like you? Do they all look like you? Is
No,
that is
no,
that
that's the
no?
thing, because on social media, I have a pretty large following. I'm like the TikTok allergist, and so
Right.
everybody
Mm,
assumes, because I kind of fit that stereotype look of somebody who lives with allergies, that I
Yeah.
must be an allergist. But if you actually meet other allergists, we are a very diverse group. There's only
Good.
about 7,000 board certified allergists in the country, so that's
Oh,
oh,
that's not very
wow.
many.
very
Okay.
few. Exactly.
That seems like not enough for the amount of allergies that you hear about these days, right? It seems like allergies are increasing in kids and stuff. Like now we can't send nuts
We
to
just know
school with
more
our
about
kids and their
allergies. Maybe they're
lunch,
just
things
more
like that.
recognized. I don't know.
Yeah, I don't know.
I don't know.
Has there
Are
been
we
an
getting more
increase?
allergies?
Yes, unfortunately. It's a little bit of, yes, we are recognizing it better. We have better diagnostic tools,
Mhm.
but there are more and more kids and adults living with things such as food allergies, which unfortunately can be life threatening. And part of the reason why I'm on
Mhm.
social media is to try to clarify a lot of the misconceptions that people have. And it's great to talk to you, because you do such a great job discussing issues related to different specialties, and you do it in a fun way. But when it comes to something like food allergies, a lot of the jokes that happen are usually in poor taste.
Right.
Oh yeah. Yeah. I mean it's
Yeah, they're usually like at the expense of the
right.
person with the allergy, which is not
Right.
funny when you have one or have a kid that has one.
Well, that's my main rule of social media is you never make fun of patients. Like
Right.
Exactly.
that's just not what you do. People it especially coming from, the physician side of things, it just undermines the trust that people have in physicians to have see any medical professional really like punching down at a patient. So, yeah, it's I definitely appreciate like bringing the education about this area of medicine that probably just a lot of people just don't know much about, right? I want to start kind of at the beginning of med school for you. So you must have been the student who actually like paid attention during like the cytokine lectures and the, learning the immunoglobulins. That stuff piqued your interest, I assume.
It did. It did early on, but I actually was not interested in allergy until I did my clinical rotations. I was really gung ho on just doing general pediatrics. My dad is a general pediatrician. I've always loved working with kids and grew up going to my dad's private practice. So that was something that I knew very early on that I wanted to do. And then I started doing rotations and realized, wow, this is a really unique field. There are very few specialists that can be a pediatrician and take care of adults, and vice versa, and be an adult doctor
Mm.
and then take care of
Mm,
children. You've got
right.
palliative care and sleep medicine are the only other specialties besides allergy where you can take care of all ages and only do residency in one age group, or potentially
Oh,
both if you do med
interesting.
peds as an example.
Yeah. Oh, that's
Yeah.
interesting.
Yeah.
I guess
Yeah.
So,
I didn't realize that.
What about family practice? Is it not that way?
well, family
Well,
practice takes care of all ages. They start out doing that. But if
Yeah.
you're in general pediatrics, you're usually locked into taking care of kids. And
Right.
I
oh yeah.
realized
Right.
Okay.
eventually I'll get old, and, my patients will
So,
grow up. And it's nice to be able
Yep.
to take care of them when they're older, but also take care of whole families. And that just opens up a level of continuity of care that I didn't realize when I was in medical school initially.
Right. And
Yeah.
our allergies, I mean, they're pretty hereditary, aren't they?
Yeah, they can pass down, absolutely. But what
Yeah.
we're
So
seeing
to
now
be
over
able
the
to
last 10
see
years
the
is
whole
people are
family.
developing allergies later in life as well. The people who did
Mm.
not have food allergies when they were kids, they're starting to develop as an adult, which is becoming more common, unfortunately.
Yeah. Well, is it gal alpha? Alpha gal?
the meat
The
Exactly.
meat thing
the
with the
meat allergy?
ticks. Yeah.
Oh my
Oh, I just
gosh.
pulled
Yeah.
that out of who knows where.
That's pretty good. I'm
That's
impressed.
amazing. No, that is becoming increasingly more recognized. Most physicians don't even know what that is. That's when
Why don't you
you
tell people what that is?
Yeah, so essentially, there's a specific type of tick called the Lone Star tick that in its saliva has a sugar molecule called galactose, alpha 1,3 galactose, also known as AlphaGal. And if you're out on a hike and you get bit by this tick, they introduce that sugar molecule into your bloodstream, and the immune system will look at that and say, we don't have this in our normal repertoire. This must be a foreign invader. We're going to create IgE antibodies, and the body becomes sensitized to it so that when you eat any mammalian meat product, you could have a severe allergic reaction to it. And it's unusual because it's delayed. So oftentimes people will eat a steak dinner at night and then they'll wake up in the middle of the night with hives and wheezing and have no idea what's
Mm.
going on. And they end up needing an EpiPen for it.
Oh,
So
wow.
this is a potentially life-threatening situation. And the mammalian meat products are not just in the food that you consume, like beef, pork, and lamb, but it could be found in gelatin, as an example. So various
Oh, yeah.
candies. It could be in dairy as well.
Mm.
So a lot of patients have to
Oh,
become
man.
vegan essentially in order to, live a healthy lifestyle. And then there's various medications that may contain alpha-gal in it as well. The only reason why we knew about this was because there was a cohort of patients who had severe allergic reactions to cetuximab, a monoclonal antibody, to treat colorectal cancer. And they were able to trace those patients to those who were getting these tick bites, essentially. And they were
Huh.
becoming sensitized to this. And the story behind it is actually fascinating. And we now estimate, based on a recent CDC report, that's the 10th most common food allergen in the United States. And it's growing
Really?
because of
Wow.
the exposure to ticks.
Wow.
And I assume the exposure to ticks is related to climate change, right? Like winters aren't cold enough to kill them off in the same way they used to be. They're moving up north from where they used to be.
Yeah, we think that
I don't
does
know.
play a role in this. However, there is a large cohort of patients in northern Minnesota as well. So some of it is a lifestyle issue where we're just,
Oh,
being
you're out more.
outdoors
Yeah.
more. You may be exposed to it, but definitely there is this tick that's starting to march further and further north that we see, especially along the East Coast and the
They're
Missouri
coming
Valley.
for us. They're
They
coming
are.
for
But see,
us.
this is all the more
You
reason
can't
to
run
not
from
go
ticks.
camping. See, this is a long-standing marital argument.
Well, so to a lot of people, the idea of an allergy to meat is horrifying, like to meat lovers out there. So is that is it like you swore off meat, like that's it, you got to be vegan? Like what can you do? Is it possible to desensitize yourself to that allergy? Can you speak on that a bit?
Yeah.
Is there
So
hope? Is there hope
is
for
there
meat
hope?
lovers out
Right.
there?
So there's a little bit of hope in certain aspects. So we can't reliably desensitize the immune system to outgrow an allergy right now, unfortunately. Avoiding tick bites is of utmost importance because we know that some people, when they get bit by a tick again, they can become resensitized. And I just read a case report recently of a patient who had a very high IgE level to alpha gal that went down after about 3 years of abstinence from mammalian meat products and not being bit by a tick. Then they got bit again and their numbers bumped up. Then they had to wait a couple of years and went down. And then they were able to do what we call an oral food challenge, where we prove to that patient that they're either allergic or not by eating that food in front of us. And when it comes to an alpha gal challenge, it's unusual because they have
Hmm.
to eat basically like a cheeseburger or a steak at 8 in the morning and then sit in clinic all day in order
Oh
to
my
see if there's a
gosh.
delayed reaction. And sometimes you have to do that multiple times because with this allergy, it's not reproducible like other food allergies. You may eat a steak dinner and have no problems, and then you have a taco the next day and you go into anaphylaxis 4 hours later. So it's challenging.
You must have a very interesting clinic.
Yes. Yes. This is what my day
You're
is like all the
good.
time, pontificating on the what if
You're,
and the
you're
risk
good.
reduction strategies, what could
Ooh,
happen. It's really
I would be
interesting every
so
day.
good at that.
Five guys, like 8 a.m. Really? You really want this double
Yeah.
cheeseburger?
We're
Like,
not even
what's?
open
Come on
yet.
now.
Yeah.
That's ridiculous.
I
Um,
would be really good at that though, because you just described every person with anxiety.
That's the problem with a lot of these issues that are potentially life threatening. There's overlapping anxiety that develops, not just for the patient, but their family members too,
Oh yeah.
because of
right.
the potential for cross contamination. If you have a small amount of
Right.
protein on a surface and that comes into contact when you ingest something, it can cause serious reactions for some people. So, what we have now is a really exciting breakthrough in food allergy treatment is the first medication to treat food allergies, actually. It's an
Oh wow.
injection that's been around since 2003 to treat asthma, but now it just got
Mhm.
approved for food allergies to reduce the chances of having these severe allergic reactions if there's
Really
accidental ingestion.
And is
interesting.
that like
How
I
often?
assume that doesn't mean that it opens the person up to just eating whatever they're allergic to whenever
Correct.
they want, but just if there's
If there's small
small
accidental
amounts of exposure?
ingestion or there's cross contamination, it reduces that
Yeah.
anxiety
Oh
because
yeah.
let's say you eat a bite of ice cream and didn't realize that it had cashews in it. Instead of
Mm.
having that high risk of needing epinephrine, it significantly lowers that risk. That's a medication, unfortunately, you have to take indefinitely, though, to maintain that level
Right.
of therapy. But we didn't really have much outside of that. We're trying to work on something called oral immunotherapy that does something similar to that, but you have to take a dose every single day. And that's something I do
Mm.
offer in my clinic. But that's something that can be difficult for a lot of families to do every single day. This is an
Yeah.
every 2 to 4 week injection.
So I was surprised to hear you say that. I guess there are some allergies that you can't desensitize to. I guess I thought that was something you could always do with most allergies, right? Little challenges that get your immune system to recognize this as not a foreign
Yeah,
thing.
like a 5-year program of
Right. But I guess
injections or
that's
something.
not always possible.
Right. So you can do that. You can desensitize the immune system pretty easily to environmental allergens. So if you've got a cat
Mm.
allergy, we could either through drops or injections slowly increase those doses, and we can usually desensitize most people to that. But when it comes to food, it doesn't really work that well to, be able to freely eat, and it can be quite dangerous. So we've tried
Mm,
injections in the past of those specific allergens, and it didn't work out so well.
Mm.
mm. So immunotherapy is like the next frontier of that's like the hot topic now in allergy. Like when you're going to allergy conferences,
Yeah, what is it called? Allergy medicine.
So it's allergy immunology, actually. So
allergy
Okay,
immunology.
yeah,
there we
Yeah.
go.
we're trained to take care of abnormal immune responses to foreign substances, which is the field of allergy. But also there are the rare set of diseases where people may be born with a non-functioning immune system. So when you think about
Mhm.
Bubble Boy and those movies, that's
Mm,
severe combined immune deficiency. You have a genetic variant that doesn't allow the immune system to fight off infections. It's not the same as HIV, which is a secondary form of immune deficiency, but there's over 300
oh, gotcha.
diseases actually of rare diseases of people what we call primary immune deficiencies. And that's part of our training as well. Not every allergist does that on a regular basis. You need a lot of resources in order to take care of these patients, but they come in all ages. You can have adults who develop this later on in life. They may have overlapping autoimmune diseases or an increased risk of developing cancer as well.
Wow.
So I want to ask from a a non allergy physician, viewpoint, because I obviously every patient that comes in to see somebody in the medical field, they always have a list of allergies, or maybe they don't have any allergies, but a lot of them have a fairly extensive list of allergies. But always feels like this constant battle of like trying to parse out like what's a true allergy and what's not a true, and I'm sure this is probably at some level frustrating for you as well, because
Yeah, maybe like
that's
an
probably part.
intolerance versus an
Right.
allergy
So, like,
or
Yeah.
something.
what is your approach to patients that maybe they've been told they have an allergy or they think they had an allergy, but you're not quite sure?
Right, right. It's a great question. And just as a quick pivot, because my memory is coming back to me about a skit you did a while ago where you were a med
Uh-oh.
student interviewing a patient saying, "Hey, do you have any drug allergies?" No. Are you sure you have any drug allergy? No, no. And then you go and talk to the attending. The attending comes back and says, "We're going to give you penicillin." They said, "Wait, no. Actually, I have this allergy list." And
Right.
that's the one overlap I've seen you talk with allergy. So I have to give you props for that because I see that all the time, unfortunately.
Yeah.
Um,
That's a
pe-
a rite of passage for med students
yes,
is the you get told one thing, and then all of a sudden the patient remembers differently, and then the
Right.
attending hears something else, and then you feel like you did something wrong as the med student.
right.
So, yeah,
Which
rite of passage
it
there.
is a rite of passage. It happened to me many times too. Um, to get back to your original question, the history is the most important aspect of this. And oftentimes we struggle with this because the patient's told, "Oh, when I was a baby, this happened." And then you're stuck saying, "Well, what do I do about that?" And it can be challenging. And so understanding what the potential mechanism is, we go back to medical school, the Jelen-Coombs classification scheme of type 1 hypersensitivity reactions and understanding what are the potential symptoms, hives, swelling, wheezing, drop in blood pressure. Did all of that happen immediately after taking a dose? I want to see some story that looks like that versus when did this rash occur? You have to get the
Mm,
timing down. You have to figure out what the symptoms are. And does that line up with one of these type of hypersensitivity reactions before you can confidently say, yeah, I think this is an allergy or no, it isn't. And we do have some availability of skin testing for penicillin if we want to classify the level of risk for a patient with penicillin allergy, which is the most commonly reported drug allergy in the United States. But we know that about 90% of that is probably not real. That most people who report that either they outgrew the allergy, because after 10 years, about 80% of people outgrow it, or it wasn't an allergy to begin with, it was more of like an intolerance where you get an upset stomach and diarrhea, and everybody thinks that's an allergy, but that's a normal expected side effect of the medication. And that's why it's really important that we educate the general public and physicians in general about what are these potential side effects of the medications and what types of reactions would prompt us to having an allergist go over the details and whether they are truly allergic or not. It's a really tricky situation that many physicians don't feel comfortable tackling because it is a liability risk that if they do have another reaction again, what would happen in the future?
Right.
Mhm.
Do you get a lot of consults like that? Uh, this patient needs this medication, but there's a reported allergy. Can you help us solve this? Is that I'm just trying to get a sense of where your consults come from. Like, what are the main categories?
Right. So, from a drug allergy standpoint, I don't get a lot in the community. I'm in private practice. That's usually
Mm,
issues that happen directly in the hospital itself, especially in tertiary care centers. And I do take care of mostly children compared to adults. So, a
mm,
lot of times they don't come to me with these issues specifically. What I end up getting a lot of consults are from my practice specifically is food allergy, chronic spontaneous urticaria or hives are main ones, and then severe asthma, severe eczema, which we take care of. It's not just pulmonologists and dermatologists. We also take care of those issues as well. And then a lot of people, the bread and butter is the severe allergic rhinitis that continually, seasonal allergies, continually gets worse and worse every year as we get longer and worse pollen seasons, rising temperatures. I had a lot of respiratory issues come into my clinic, either post COVID infection, where they were getting a chronic cough, or from the wildfire smoke coming in from Canada into my area last summer. A lot of people were getting sick with all sorts of respiratory and sinus issues because of that. And then I occasionally get nasal polyp consults as well.
mm, okay. Keeps you plenty busy.
Yeah.
And so I want to talk now about your social media presence here because like many of us, it was like around COVID, that lockdown is when I got started on TikTok, and
Right.
I'm not sure when you started your account, but um, uh, I guess just let's just jump into the hula hooping. Let's just get that. Let's talk about this thing
Yeah.
because I think you were known for that. Like I've seen several videos of where you're educating people while hula hooping.
Yes.
Um, I'm just gonna stop talking and let you just discuss your hula hooping
Yeah.
prowess here.
So I'm hearing the question is just
Hula hoop.
what?
Yeah, what?
If I could
What's
do
going
it
on?
while we were talking, I would, but I have too much around me. But
Yeah.
this is the shtick. This is the story. So I'm 9 years old. I've got an older brother. We would go to bar mitzvah parties, right? And part of the gig is there'd be these different games, you win prizes, and one of them was a hula hoop contest. And I was absolutely terrible. I'd go up there and I couldn't do anything with it. And I'd see these kids get these huge chocolate bars and toys and whatever. And I thought, I got to figure out how to do that. So I told my mom one day, take me to the sports authority. I'm going to figure this out. I bought 2 green hula hoops, went into my parents' basement, and just sat there for hours and taught myself how to do it.
There you
And
go.
when it came,
Self-taught hula hoop champion.
yeah,
Yeah,
so
There
this
you
was
go.
pre-YouTube too,
this
so
is
you didn't even
pre
have something to
YouTube.
watch.
Exactly.
Yeah.
I just figured it out myself, and ended up winning a bunch of contests when I was 13 years old or whatever. And then when it came time to applying for college, I thought to myself, I got to be a little bit more unique and put something in my personal statement that would be interesting. So I actually wrote about my experiences teaching myself how to do this. And the concept is if I put my mind to something, I can do it. And
Mhm.
Oh, I love it.
I was in a combined undergrad BA MD program, and that was my shtick talking about that. Um, then
That's
seeing
great. I bet
shifts,
they love that. I
I
bet they love that. You can imagine coming across that personal statement. You it's like,
exactly.
okay, I can
It's
get
it's
behind
unique.
this.
It's
It's
a little
good.
quirky. It's a little weird, and that's
Yeah.
okay. And I embrace that. I think it's okay to just share some unique parts of your personality, and that's one way to do it. So when it came time to going on social media, I started out on Twitter right down around lockdown. Then a medical student had asked me, "Hey, you do a really good job communicating these things. Why don't you go to TikTok?" And this was
Yeah.
spring of 2021, and I said to myself, "I thought this was just a dancing app. I had no idea what this was." And I said to myself, I'm going to try it. I made some videos. I started talking about COVID initially. And then one day I thought to myself, I saw all these dancing videos. Why don't I show people what I can do? And I
Uh-huh.
just one day took one of my old green hula hoops and started hula hooping on camera. And a bunch of people like, who is this doctor hula hooping? This is crazy. And it just gained traction and people thought it was, fun, hilarious, and
Yeah.
also informative where I would, show captions about whatever we're talking about here. And then occasionally I'll do lives where I'm raising money, hula hooping and making fun of
Mhm.
myself, exercising, putting on, 80s, 90s music and dancing and hula hooping at the same time to showcase that. And we've raised over $30,000 doing that. It's
That's
been
awesome.
That's
it's
so
been
fun.
Well, it's
awesome.
the perfect thing for TikTok. It's like
It
a
is,
very,
yeah.
like, great fit for that app.
Yeah,
So,
it's just niche and silly. And I
Yeah.
try to tell people, whether they have difficulty exercising or getting started, that it's a great activity you can do. You can have a lot of fun with it. And I want people to be comfortable in their own skin, with whatever they
Yeah.
enjoy doing. And so, you see a doctor doing that and kind of breaking the barriers down and getting comfortable talking with patients and the patients feeling more comfortable talking with their doctors. I'm just trying to break those barriers down.
And
Do you have a hula hooping clinic?
I wish I
yeah.
did, but the rooms are too small.
Fair enough.
So you could come in with a hula hoop and the little unicorn headband and, just really make the whole process less scary for kids.
Well, he's got his bow ties.
He
That's
does,
what I
yeah.
do.
Is
Like,
that what the bow ties are
yeah.
about?
You're wearing a bow tie now. A lot of your I mean, is it all your videos you're wearing a bow tie pretty much?
Almost
Like,
all of them. So
yeah, yeah,
so oftentimes I'm making videos either right after work or I have a patient cancel, so I'll make a quick
yeah.
video or whatever. I started wearing bow ties actually because in between college and medical school, I worked for 6 months for a charitable foundation that did a lot of work at a public magnet high school, and they had a dress code. So you had to wear a tie to go into the building.
Mm,
And I decided, it'd be fun to wear a bow tie. I hadn't really worn many at the time, so I went on YouTube and taught myself how to tie a bow tie and taught some neurology courses, which is fitting because as you with your neurology character wear bow ties too
yep,
sometimes, right?
yep.
So one day I said to myself, I'm just going to put on a necktie today. I don't know why I did it, and I went to school, and one of the students looked at me and said, Mr. Rubin, you're not cool anymore. You're not wearing
Uh-oh.
your bow tie. And that has
Oh,
stuck
man.
with me ever since, thinking about these impressionable teenagers who were telling me, you got to wear the bow tie again. And
Bow tie culture is a
it,
thing in medicine
it
too.
is.
It's there's it hits certain specialties. There are
Hmm.
certain specialties that are more bow tie oriented.
I
I
think
wonder what
so.
that what why?
Surgeons used to wear them more commonly, like in the
Now it's just
50s. It was
scrubs.
a thing
Yeah,
back then, but
yeah.
now it's a
Yeah.
little bit different now. But I remember when I did my medical school class picture, I was actually kind of embarrassed of it. Of like, I thought people would look at me kind of
Mm.
weird wearing a bow tie. So I put on a necktie and took that picture. And ever since then, I've kind of regretted that. I was like, why did I do that? That's not who I am. Like, you never see me with a
Yeah,
necktie. It's
yeah.
usually with the bow tie. And
Well, don't kids pull on them
Yeah.
too?
they
Kids
pull
put
on
the long,
neckties.
Yeah.
Yeah.
yeah,
So
they
Mhm.
so
strangle
they
you.
look at this and I'll have, different patterns. I even have like a Pikachu bow tie, um, that I'll wear. And kids love it. And then they can't grab at it. It's cleaner. And even if it's just,
Right.
Yep.
slightly off angle or whatever it is, it still looks more
Uh-huh.
fun than, a
Yeah.
really long crooked necktie.
Do you have one that
Yeah.
spins?
No, I don't.
I
I
bet we could
wish.
find you
I
one.
think I
Yeah.
have one that lights up though.
Oh, that's good.
Ooh,
That's
that's
good.
pretty
Have you ever
cool.
had any followers send you bow ties?
Yes, I actually have.
Yeah.
One
It
family in
doesn't surprise
Colorado
me.
sent me like 20 bow ties because their 13-year-old son actually handmade them. And
Wow.
and he had moved out of the house and they had all these extra bow ties lying around and they sent them to me. I had one guy from the Netherlands send me a bow tie. The one that's in my profile picture was a bow tie maker actually in the Netherlands sent me one. So it's pretty
That's
cool.
pretty cool. Yeah.
That's cool. Well, let's take a short break. I want to ask you some more questions about being an allergist immunologist. Oh, Kristen, do I have an AI platform to tell you about?
Ooh, tell me.
Yeah, it's called Precision. This is the first ever EHR integrated infectious disease AI platform.
That sounds
Yeah,
fancy.
well, one of the hardest things of infectious disease is like, figuring out what to do with all the information, and
Yeah.
it's always coming in at different times, and figuring out what works best for the patient.
Yeah.
Well, this automatically highlights better antibiotic regimens.
Ooh, I would
Yeah.
imagine that helps with antibiotic resistance.
It does. To see a demo, go to precision.com/KKH. That's precision spelled with an X instead of an E. So PRXCISION.com/KKH. All right, we are back with Dr. Zachary Rubin. Zach, so I want you to help me figure out a character for allergy immunology. Okay, so I deal in my content. I deal in like interpersonal conflict. Like, are there any? It seems like you're a nice guy. It doesn't seem like you have any conflicts with other like areas of medicine. Are there any pet peeves? Any kind of things that I could really get in there and kind of
Basically,
explore?
he's asking you to do his research for
Yeah,
him.
to create a
So
character
let's be
since
clear.
since I'm like the only one you've ever met before. That's so harsh. Um, you know, like you said, we don't really have a ton of conflict with other specialties. We do have some overlapping features with dermatologists, pulmonologists, as an example,
Mm,
sometimes rheumatology. So there's a little bit there, but we're kind of off in our own world, right? I mean, you could think of like
yeah.
someone who's aloof a little bit to that extent, if you're thinking about
Oh,
kind of
that's good. That's
imagery,
good.
right?
Yeah.
Right,
Yeah, yeah.
to give you some buzzwords there. Um,
There's no cardiologist to your nephrologist, basically.
exactly. We're
Yeah.
not carrying around a canister of salt and just screaming into the void. We don't have that. Uh,
It's probably a good thing. It's
it, it
probably a good
it
thing.
What
is
are
a
the
good thing for my
qualities,
mental
though?
health and my physical health. Yes.
That's right.
Yes. Well, what are the qualities that make somebody a good immunologist or
Well, that's a good question.
allergist? Like, what? I mean, you seem to be maybe detail oriented.
Yes, like infectious disease. We're very detail oriented.
Okay.
Mm,
It's one of the jokes that I don't know if you've ever said this in your videos before, but that infectious disease we talk about sometimes is, if you're in the hospital getting a consult, you often do a chart biopsy. Like you're literally going into
yeah.
the nitty gritty details of everything. And for me, drug allergy, we have to do that where I try to figure out
Oh, okay.
when did this drug allergy get put into the chart? When did it actually happen? This was back in 1984. Why? Who did that? And then I can go to the patient and say, can you tell me what happened on the night of September 7th, 1984? No. Okay.
Yeah.
So
Yeah.
there is the element of being detail oriented, a lot of pontificating. Well, if
Mm,
this happens, then maybe this would happen. If we do this test, there's these sets of risks and benefits. It is often going down into a rabbit hole that's actually becoming more common now because it used to be a lot of people, especially in primary care, would just order a panel of tests like food allergy tests or environmental tests. But we're learning more and more that that's really an inaccurate way of doing it. It can actually cause more problems for the patients if they
mm,
do that, especially with food allergies, because then you're avoiding a bunch of things that you don't need to.
Mm. Yeah.
mm.
So we often try to spend more time with the patient to discuss risks and benefits of these specific tests that we're doing and try to convince them, are you sure you want to do this? Do you really want to get that test?
Yeah.
This is what could happen. So I hope that gives you a little bit more clarity into.
Yeah. That's good.
Yeah. Yeah.
Like, what are there any things that you would want either, general pediatricians to know or just any medical professional to know about allergists that they probably don't know?
We're not really huge fans of prednisone, vitamin P.
Oh,
Not huge
okay.
fans of it as
All
much as
right.
Why
possible.
is that?
So, as an example, patients will go to their primary care provider. They'll say, "I have hives all over my body, and I
Hmm.
can't get it to get better." And they'll often kind of try to wave a magic wand and give prednisone to just get that to go down more quickly. But then they'll come into my office and they'll say that their rash is worse than it was before. They'll get kind of a rebound
Oh.
effect, or because they had that relative feeling of the rash is quiescent, all of a sudden it's worse. So it's perceived as being worse, and then they're trying to figure out why this is going on. And many times we can't figure that out. And then they'll go through this laundry list of saying, is it this detergent? Is it the soap? Is it this particular product? And many times it's actually not any of that.
Mm,
And I think people just need to be a little bit more uncomfortable with uncertainty
mhm.
when it comes to what is the exact reason why something is happening, and being more comfortable understanding that, yeah, you probably have twitchy mast cells is what's going
Yeah.
on. It's just they're just dumping a bunch
Okay.
of chemicals for whatever
Talk to me
reason.
about mast cells because that's also a thing in certain forms of like Ehlers-Danlos syndrome and like with hypermobility, which is something that I do have. So what I mean that those two things seem totally unrelated, right? To be hypermobile and then to be allergic to something. So what tell me what the mast cells are.
Yeah.
What's going on there?
So we do see a quite a bit of overlap between patients who have Ehlers-Danlos syndrome, which is a hypermobility syndrome, and having called mast cell activation syndrome. So
Mhm.
mast cells are part of your immune system, mainly on the innate side, that kind of surveil to see, hey, is there a parasite? Is there venom? Is there some type of wound going on? And it'll release several chemical mediators to bring other cells of the immune system towards that. And so that is the actual allergy cell of the body, the typical one that we think about, because they will activate in response to pollen, to foods, to latex,
Mm,
to all these other things. And potentially it could be life threatening or it could be a nuisance. There's a whole
Mhm.
spectrum of it. So if anybody has allergies, it is actually a form of abnormal mast cell activation. But for
Hmm.
a certain group of people, we don't know how common it is. They could seemingly have severe reactions on a whim, and the exact trigger is not really well understood. One of the common ones
Mhm.
is stress, because stress actually has a hormonal pathway that leads to direct mast cell activation through a hormone called CRH, or corticotropin releasing hormone. There's that aspect to it. But changes in weather could potentially do it. Foods that you normally can tolerate can just do it on a whim. And then because mast cells are all over the body, if they're activating, let's say, near the brain, you could get brain fog and anxiety from it. If it's in the gut, you can get bloating, diarrhea, vomiting. In your skin causes flushing, hives, and swelling. It even can lead to potentially joint pain as well. So it causes a multi-systemic problem that if you take various medications that block the downstream effects of that, such as antihistamines, leukotriene receptor blockers, mast cell stabilizers, and you feel better, after ruling out a bunch of
mm,
other things, you may have this at mast cell
mhm.
activation syndrome, or MCAS.
God, mast cells just cause problems.
Yeah.
God.
What do we need those for?
Yeah. I mean,
I'm just kidding. We need them for a lot of things.
we
Pretty important.
probably do.
Yeah.
um, all right. So what is next for you in this online persona that you've built up? This are you gonna keep making these videos? Are you gonna like do you have plans for this? Is this really just, hey, this extra thing, I'm just gonna keep going with it and you have your job as a seeing patients and do you have big plans, I guess is what I'm asking.
Yeah. So I really enjoy what I do on social media in terms of educating people. I'm starting to get into some leadership positions at like the society levels for various allergy societies. So I've actually joined a social media subcommittee to try to encourage other allergists to try to help
Oh,
educate
that's great.
and get the word out, and
Oh
encouraging
man,
people
we need
also
more. We need
to
more of that.
yeah,
Yeah.
we need to help debunk that kind of misinformation. It's not just me, but there's several allergists, especially on Instagram, who are doing this kind of work now, which is great. So I'll be presenting for the first time at a national meeting next fall in Boston. I'm very excited about. Um,
Congrats.
I'm thinking
That's
about writing
great.
a book. So that's something that's going to be in the works. So it's a slow go with it in terms of other potential opportunities that I want to do, but it's opened the door to a lot of connections. Meeting you guys as an
Mhm.
example. It's an
Yeah.
honor to be able to do this. It's been great meeting other physicians and other specialties, and this is something I never thought was possible until I started doing it. That's my message to anybody else who's a physician out there. It's like, just go ahead and make some content. You never know where it leads.
Oh, I love
Yeah.
that message. And you mentioned the leadership positions. I was gonna ask you, like, what are the big advocacy issues around your specialty? Like, are there anything specific to what you do that you're really focused in on?
Yeah, one of the things that I've been getting into is, and I really respect a lot of the work you do, calling out insurance companies. But in my field, there's such a poor access to epinephrine autoinjector devices. They're ridiculously expensive for no reason, essentially. And
Mhm.
so in Illinois, where I'm at, we actually, starting in January of 25, will cap epinephrine autoinjectors to $60 a twin pack, which is a huge deal because prices for some people are hundreds of dollars, making it inaccessible. And then if people have anaphylaxis, they end up, going into the emergency room without any treatment. People are afraid of needles, and we're about to get our first needle-free option for epinephrine in a nasal spray coming out in about 6 to
really?
12
wow.
months. It's ironically called Neffy, which I think is a fun name.
Nice.
So there's actually a bill that was introduced to Congress recently trying to cap EpiPen prices at $60 a twin pack nationally. So I'm going to see if I can try to help with that. There's various food allergy research and advocacy groups that help with these types of endeavors. As an example,
I've heard about the EpiPen issue with regard to like having them on planes, like having
that
that
they're
be
not in the
available, that they're not in
emergency
the
kits or
kits.
whatever.
It seems so obvious, right? Like this should be part of every first aid
Yeah.
kit.
absolutely,
and
access to it is very poor in general.
yeah,
In Europe, aren't they like $5 or something? Like it's not necessarily very expensive to make them, right? It's just for some reason people sell them for a lot because you can, I guess.
I don't know. I don't know how cheap, how hard it is to make
I
epinephrine.
feel like I feel like it's one of those things that's easier to
I'd
get
squeeze it
over
out of my
there.
own adrenals if I could. Just
The
give it to
actual
people.
to make the drug itself, it's super cheap. A
Yeah.
lot of it is intellectual property issues, but it's
Yeah.
estimated that it only costs about $30 to make.
Okay.
So
There you go.
it's in Europe. You're right. It's sold at a much lower cost, if not free.
Yeah.
This is a big problem, and like I mentioned earlier, a lot of work needs to be done in terms of educating the public about these issues, especially for the food allergy community, as an example, so that they're not the butt of all jokes, so that they can
Yeah.
go to a restaurant and feel safe there, so that they're not bullied by other families or even teachers, which has been reported.
Oh, really?
And as an example, there was a student in Texas last fall who was a football player who disclosed that he had a peanut allergy, and students put peanuts in his locker room, and he had hives from it. And the school
Yeah.
district said, "Oh, that's not bullying." And these
No,
types,
it's
Oh, come on.
assault.
yeah, exactly.
on.
It's a big problem, and so a lot of that comes with just trying to educate the public and trying to normalize that people live with this. It's not a fad diet. This is a chronic disease, and so
Yeah.
I'm trying to
That's
help
right.
put the word out and help people understand why we need to take this seriously.
Well, thanks
Yeah.
for doing that work.
Food allergy is such a hard thing too because you have to eat and food is everywhere and we, at least 3 times a day. You've got like anytime there's any issue involving food, that's going to consume your whole life, because we do have we have to do it so much. It's everywhere and you can't not do it because you have to eat to survive.
Yeah.
So, I have real sympathy for people.
Well, what I want to do now before we let you go is a little activity. There,
Okay.
I came up with a little game we could play. So I have these. Basically, Kristen is going to draw 2 different pieces of paper that are in front of her. You can't see these. No. Leave them there. Leave them there.
Okay, you got to fix it. I just messed it up. I was just going to show
No,
that they're
yeah.
little tiny scraps
Yep.
of paper that he
Little
tore up.
tiny scraps of paper that I've written things
And
on.
apparently, yeah.
So what Kristen is going to do, Zach, is draw one from one pile and one from the other pile.
Okay.
And one
See,
pile.
even I don't know what we're doing before we do this.
Yep. One pile has a type of allergy, like a category of allergy.
Okay.
Of
Okay.
allergen, I guess I should say. Maybe. I don't know. Anyway. And the other pile is a number. And so she's going to draw one and then the number, and I want you to give us that number of different allergies in that group.
Oh,
Okay?
Wow. Okay.
Let's try it. I don't know. Let's just give this a shot. Okay. So
Okay.
Kristen, go ahead. Draw one from here first.
Okay. So this is the category. Medication.
Okay.
And then now a number.
Oh, 9.
And then what am I supposed to do with this again?
9.
Give us 9 medication
medications.
allergies.
Yeah.
Like allergies to 9 different medications that you see.
Okay, that I see. So penicillins, sulfa antibiotics. We're going to say aspirin.
Okay.
Ibuprofen.
Hmm. Those are all the ones I
Neosporin.
like.
Neosporin.
Neosporin.
Okay.
5. We're at 5.
Okay. Benadryl, ironically.
Oh, okay.
Huh.
Okay. Let's say, doxycycline, so the tetracyclines.
Oh, yeah.
Let me
Yeah.
see there.
2 more.
I got to do 2 more? Oh, my gosh.
2 more.
Well, I'm going to say adhesives, part of
Okay.
bandaging.
Yep.
We see a lot of
Yep.
that.
I see that. I use a lot of tape in ophthalmology.
And IV contrast.
There you go.
Oh.
Nicely done.
That's
That was the
impressive.
highest number, by the way.
Okay.
Oh my gosh. Okay, so it's going to be easier from here.
you got that out of the way.
Got me sweating a little bit there.
That was really good, though. Is prednisone, do you see like allergies to prednisone? Because I see that on people's list a lot.
Yeah. So the thing is that what I see is usually adverse reactions to it where they feel really crummy on it and they put that on there as an allergy. And theoretically, you can be allergic to it. Really, any large molecule you can be allergic to.
Okay.
But the vast majority of like we talked about before, it's more of an expected side effect. And so if we counsel patients on saying, hey, when you take prednisone, you could be really hungry. You may not sleep well on this. It could change your mood for a while. It throws off your sugars. And if you know that ahead of time, it can be a little bit easier to manage instead of saying, here's this medication, good luck. They take it and they feel terrible and then they report that. And then somebody will write down that it's an allergy. We don't really have a distinction between the adverse event profile on the chart versus a true allergy and contraindication.
Okay, that's helpful. All right, let's do another one.
Okay. Category is.
We might not even be able to, I don't even know. I just wrote that down.
Well, just going to try.
It's a good start.
Yeah.
Okay. Mold.
Okay.
And then the number. Oh, William.
Oh, let's do a different number.
Okay.
Was it too many?
It was more than 9.
Actually, I forgot. I forgot I had a 10 on there.
Oh, God.
Mix them up.
Okay, this is easier.
Okay.
3.
Okay. So Penicillium, Cladosporium, and Alternaria.
Oh, my gosh.
I just rattled those right off.
Maybe you could have done 10. My goodness. I'm impressed. What were they again?
Penicillium, Cladosporium, and Alternaria, which are some of the most common indoor-outdoor molds as examples.
Okay.
And penicillium is what?
A specific species of penicillium is what, created penicillin, yes.
Okay.
All right. I have no follow-up questions.
Okay. Next category. Okay, a lot of people are going to be able to relate to this one, I think. Tree.
Okay.
Oof. 7 tree allergies.
Okay. Let's see if I can do this. Oak, maple, box elder, birch. Birch is the worst, by the way.
Huh.
Really? Okay.
Yeah, because it can create something called oral allergy syndrome. So there are various foods that are mainly fruits and vegetables that the protein structure is similar to various pollens. Birch is one of the worst because it can create allergies to peaches, pears, plums, apricots, apples. There's a whole list of it. You can always look online. It's an interesting list. Causes localized irritation, itching, swelling. If you cook, can, and process it, though, you can usually tolerate it if you have that. Rarely do you need an EpiPen for something like that. And I know I digress because I'm trying to think in my head.
Try to buy yourself some time.
That's what you're doing great. I think I think you got like 4 already.
Yeah, I got 4. Did I say maple already?
Yes.
I think you did.
Oh gosh. Okay. Ash.
Okay. All right.
Okay, that's 5. And then I need 2 more?
Yes.
I don't even
7.
think maybe there are only 5 trees out there.
No, there's a lot of trees. It's just the ones that I'm thinking about that are most allergenic that I test for.
Yeah.
And also you're putting me on the spot, so no pressure.
True,
that's fine.
True.
Yeah, there's Bradford pears as an example. That's number 6,
I did Google a list.
Ash juniper.
Oh, there you go. Yeah, that's
cedar
one I see
fever.
here.
That's the worst in Texas.
Oh, yeah.
I see mesquite. Mesquite is one I saw.
Mesquite trees. We had a lot of those.
Cedar, pine.
Texas.
Yeah.
There we go. So we went over.
Oh yeah.
Okay.
All
So
kinds.
basically all trees.
All trees.
Yeah.
Every tree.
Yeah. But so here's a little misconception that a lot of people don't understand. You hear this myth of eat local honey to treat allergies. You hear that all the time. And the idea is that, well, if you eat honey, you're eating pollen that you're allergic to. So you eat higher amounts of it, it'll desensitize your immune system. But if you were really allergic to that pollen, you'd be having itching in your mouth if you were. But you're not actually allergic to that pollen because it's insect pollinated. Bees have to move that pollen. That's not what you're allergic to because you're not exposed to it on a regular basis. You're allergic to the trees that I just mentioned that are wind pollinated. They're blowing millions, if not billions, of particles that you're breathing in regularly to create that allergy.
Yeah. Interesting. So that's a myth to eat local honey for allergies.
Yeah.
How about that?
Let's do one more.
One more. Oh, yeah. Okay. Category is grass.
Okay.
And the number is 6.
Timothy, June, Bermuda, Bahia.
Dang, he's good.
I know. I haven't even heard of
It's
some
almost
of
like
these
he's a
things.
professional.
Okay.
Okay. Last one's going to be hard because I think I named everyone in my panel. Let's see here.
I think you got, it looks from what I can see.
Google
Orchard.
only
Did I
turned
say
up
orchard?
4.
No, you did not.
Oh, okay,
That's on
there you
there.
go.
Okay, there you go.
There you go.
Nicely done. I'm impressed.
Yeah.
I thought this would be a really
That's
hard.
hard. That's a hard game. You
It's
put
a
someone
hard
on
game.
the spot.
Yeah. You put me on the spot too. This was not like planned,
Right.
folks.
I did
Right.
not.
No.
I did not prep you ahead of time,
No.
everyone. So that just shows you.
As
what an
soon as this
amazing-
call ends, you're going to be rattling them off in your mind. Like just all the pressure's gone.
Well, my last question before you go is do you do the skin test? Does that still happen?
Yeah.
Yeah, you do that,
I
right?
do that every day. Yeah.
Like down someone's back. It's just like.
Yeah, I either put it on their arms or I put it on their back, depending on the patient. Yeah.
Is that painful?
Sounds miserable.
So nowadays we have plastic that we can use to scratch the skin. It's not very painful for adults. For kids, it can be uncomfortable because it's an abnormal sensation. The worst part is sitting there for 10 to 15 minutes itching and potentially having like a burning sensation. With
That's
that.
what I'm thinking.
That's
sounds
the part
miserable.
that's tough for patients. And then for older patients, if that plastic, it's very shallow. It's only a couple of millimeters long. We may not hit those mast cells to create a reaction. So we may have to do intradermal injections of the allergens. And so that may or may not be, comfortable.
More.
Less itchy than the skin prick testing. But, it depends on the practice you go to. I don't put a ton of tests on because I know that these pollens and different allergens are cross-reactive. The immune system sees parts of it and will react to several different things. So I don't need to put 100 things on there.
Right.
Older school allergists may put a bunch on there, but I don't think it's necessary anymore.
Yeah. Huh.
Well, fascinating. I've learned a lot about allergies.
Yeah, me too.
Thank you so much for joining us.
I've also learned that allergists are much smarter than you.
Oh, they just oh man.
Yeah. He's my benchmark, right? Of how smart is a physician? Because he's the one I know.
I'm very smart
they're a lot smarter than you.
I'm very smart about a very specific thing.
That is true. You're very smart about eyeballs.
I'll answer any question you have about it. You want to know about the 9 different layers of the retina? Let's do it.
I don't.
Okay. Well, maybe for another podcast.
I guess the one fun thing about this is that you study an organ that's immune privileged.
That's right.
Oh.
Yeah.
That's right.
Yeah.
Mm-hmm.
So
exciting stuff.
what does that mean? Like that it gets protected above other things, or that it doesn't get? No, it does get allergies.
There are certain parts of the eye that don't have blood flow, basically, and so it doesn't. You don't have like an immune reaction.
Yeah, there's very few immune cells in the eye itself.
Yeah.
So you can get away with a lot more research in certain aspects of it because of that. So it's a cool term, immune privilege.
Yeah, it is.
It is. Yeah.
Very privileged. Well, so let's tell people where to find you. You're on. We've already covered TikTok, obviously. So what's your name on TikTok? What do you go by?
It's Rubin_allergy because all the cool allergy names were already taken. Pretty much when I started. So I try to keep that consistent. RUBIN_allergy, TikTok, Instagram are my main places, but I've recently tried to start a presence on YouTube and Facebook as well, especially on Facebook because people were stealing my content and pretending to be me.
What that's like. I know what that's like.
Yeah, I know.
Yes, you got to get on. You got to get on all the platforms.
We've
Just
done
have
that.
a presence there so that you can keep all your bases covered.
And you're trademarked now, like that. There've been so many
That's
people
amazing.
doing that I just got it trademarked.
And the
So.
Dr. Glaucomflecken trademark.
You could technically be TM.
That's right.
Dr. Glaucomflecken, TM.
Yep.
Well, keep it up. Really enjoyed seeing your content. It's very unique and informative. So everybody needs to check that out. And yeah, keep it up. Thanks for joining us.
Thank you for having me. It was really nice to meet you.
Hey, Kristen.
Yeah.
Can I interest you in a Demodex mite?
No, you cannot.
Why? Look at it. Look how cute they are. Little beady eyes and multiple legs of thorax and abdomen. Doesn't this look cute?
No,
Here.
I mean, it's a stuffed animal, so it does have a certain quality to it, but I don't want an actual Demodex mite.
Well, the real ones do hang out on your eyelids.
Yeah, see, I don't want them there.
They cause red, itchy, irritated eyelid, sometimes like flaky buildup on your eyelashes.
Disgusting. I do not want that.
Well, don't get freaked out by this, okay? You got to get checked out.
Okay.
It's eye doctors that we're used to diagnosing Demodex blepharitis. It's a pretty common disease.
You see these little guys in your little microscopes?
My microscope might not be powerful enough to see this, but I can see the telltale signs of it. That's for sure. To find out more, go to eyelidcheck.com. Again, that's EYELID check.com to get more information about these little guys that cause Demodex blepharitis. All right, let's take a look at a medical story sent in by a listener. So we have a story from Gene. Gene says, when my son was 8 years old, he and his older sister went to our family doctor for a pre-scout camp physical. My son's first physical. He went back to the lab area. My more experienced daughter took the cup from the nurse and slipped into the bathroom to provide a urine sample. She returned quickly, moving to the next station. The nurse gave my son a cup and guided him into the bathroom. He didn't come out. And he didn't come out. And he didn't come out. Everyone was waiting patiently. The nurse came to check. I shrugged, so she went on with her endless flow of tasks. After several minutes, the door opened a crack so that I just my son's lips showed. Mom, come here. I went over to the door. He said, the nurse asked me to get her some tea in this cup, and I can't find the tea. I explained what he was supposed to do with the cup. His jaw dropped. No. I affirmed the instructions, yes. The door closed and he came out shortly after, still in shock. He whispered, so how do girls do that?
Go ask your sister.
I remember my first physical as a kid.
It's a weird thing to do.
Because it was like in a big, I felt like it was like at a gym. Like all the kids
sometimes
were there.
With school, they'll bring the doctor to the school.
Yeah.
Yeah.
And I remember there were like 15 boys.
Yeah.
And we're all standing in a line and we all had to drop our drawers.
Right.
And just the doctor went down the line.
I don't know that would still happen.
That's
today,
how it happened to us.
But back then.
That's how it happened. Oh, that's a great story. Thanks, Gene, for sharing that.
That is really cute.
You can send us your stories, knockknockhi@human-content.com. And thanks for joining us. What a fun episode.
Yeah.
I got to learn a lot.
They know so many things.
Yeah, I'm telling you. Those they're the people that were interested in all the most difficult parts of med school.
Yeah.
Like the cytokines,
rheumatology, infectious disease,
all the
allergy,
immunology stuff. That is hard.
Yeah.
That's like my brain. I don't think I was capable.
Yeah. Are they like chemistry kids? Is it?
I don't know. Maybe.
Is
Probably
that
should
what
have
it
asked that. I don't know. Probably.
I mean, you learned it, right? Was it chemistry?
It's chemicals. I don't know. God, stop asking me about chemistry.
See, they're just much smarter than you. People are going to be mad at me thinking that I'm being mean, but no, it's just a fact.
All right. Well, tell us what you thought of the episode. You want to hear more about different areas of medicine that we don't talk about a whole lot, or different parts of healthcare. Allergies is just one of those things. I don't think this is the first time probably that we've ever even mentioned allergists, immunology, chemistry on this podcast. Lots of ways to reach out. Email us, knockknockhide@human-content.com. You can visit us on our social media platforms. Hang out with us in the Human Content Podcast family on Instagram and TikTok at Human Content Pods. Thanks to all the great listeners leaving feedback and reviews. If you subscribe and comment on your favorite podcasting app, we can give you a shout out, like on YouTube at Casey Cassis2498 said about the melanoma knock knock eye episode. Did an episode about melanoma. Said, okay, this was horrifying but fascinating. Thank you again for the eye education.
I want to point out it says eye-education.
Eye-education. It's good. Good. It's
It
good.
hurt you.
That's fine. That's fine. That's a good one. I haven't heard that one. That's good. But yes, that was it is a bit of a horrifying topic, but most eyeball things are, to be honest. Full video episodes are up every week on my YouTube channel at Glaucomfleckens. We also have a Patreon. Lots of fun perks, bonus episodes. We react to things, hang out with other members of the Knock Knock High community. We're a growing little township. We're there and have leadership positions in it. Early ad-free episode access, interactive Q&A, live stream events, much more. Patreon.com/Glaucomfleckens or go to Glaucomfleckens.com. Speaking of Patreon community perks, new member shout out. Joshua M. and Lisa P. Thank you both for being patrons. Welcome to the team. And shout out to the Jonathans, as always. A virtual head nod to you all. Patrick Lacia, Sharon S., Omar, Edward K., Stephen G., Jonathan F., Marion W., Mr. Granddaddy, Caitlin C., Brianna L., KL, Keith G., JJH, Derek N., Mary H., Susanna F., Jenny J.
You did it!
Muhammad K., Aviga Parker, Ryan, Muhammad L., David H., Jack K., Medical Meg, Bubbly Salt, and Pink Macho. Patreon roulette time. Random shout out to someone on the emergency medicine tier. Joyce O. Joyce, thank you for being a patron. And thank you all for listening. We're your hosts, Will and Krista Flannery, also known as the Glaucomfleckens. Special thanks to our guest, Dr. Zachary Rubin. Our editor, our executive producers are Will Flannery, Kristen Flannery, Aaron Corney, Rob Goldman, and Shanti Brick. I have to read the producers first. It's very important.
Okay, you do what you need to do.
You know what Aaron would do to us if we forgot.
You know what? You
part?
tell Aaron to come talk to me.
Yeah, okay. Our editor and engineer is Jason Portiza. Our music is by Omer Ben Zvi. I'm not usually afraid of Aaron.
Yeah, what's up with that?
I don't know. I just because we just saw him recently,
yeah.
and so it just
He's like
sometimes he gives it the stare. He's got he's got a little.
He's got a stare.
He's got a
I
stare.
feel like it can mean multiple things though, and usually it just means he's trying to think of some witty comeback. So.
Did I do music? Music.
Yes, Omer Ben Zvi.
Omer Ben Zvi.
Who doesn't deserve any of this.
Oh, I'm sorry,
Nonsense.
Omer. We should put Omer first.
I know.
I'm going to do that first next time. To learn about, Aaron can go last. To learn about our Knock Knock Highs program disclaimer and ethics policies, submission verification licensing terms, and HIPAA release terms, go to Glaucomfleckens.com or reach out to us, knockknockhide@human-content.com with any questions, concerns, or puns. Knock Knock High is a human content production.
Knock, knock, goodbye.
Hey, Kristen, you know what these little stuffed Dax Copilot dragons make me think of?
What, these little stuffed animals?
Jonathan.
Oh.
I need to get Jonathan a little hat
Yeah,
like
a
this.
little co-pilot
And
hat.
what if he had wings too?
That would just
Flying
be a game
around,
changer.
flying
Yeah,
around.
I'm surprised he doesn't already have wings. You should
Just
have thought of that.
Fix and burn out anywhere he goes.
Mm-hmm.
Well, that's what you get with the Nuanced Dragon Ambient Experience. Did you know that?
That's pretty awesome.
Absolutely. 80% of patients actually say their physician is more focused with the Dax Copilot. 85% of patients say their physician is more personable and conversational with the Dax Copilot. It really does make a huge difference in patient care.
And in that patient-physician relationship.
Absolutely. You just get to focus on what got you into medicine in the first place.
Right.
You know, not documentation.
Right.
It's taking care of the patient. To learn more about the Nuanced Dragon Ambient Experience or Dax Copilot, visit nuance.com/discoverdax. That's nuance.com/discoverdax. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.